When you picture a major burn, what comes to mind? Probably the flames, the visible injury, right? But what if I told you the real, immediate fight for life isn't on the outside at all? It's a silent crisis happening inside the body, and it all goes down in the first 24 hours. Okay, let's dive into this incredibly critical window for survival.
So let's just jump right in with a question. You've got a patient, a severe burn covering almost half their body. What do you think is the number one thing, the single greatest threat that's going to kill them in these first 24 hours? Take a second to think about it, because the answer might not be what you expect. You see, the real enemy here isn't the fire itself, not in this initial phase. It's the catastrophic chain reaction that the burn sets off inside the body. We're talking about a full-on systemic crisis, a hidden danger that's pushing the entire system right to the edge of collapse.
And that crisis, that hidden danger, has a name: hypovolemic shock. So what is that? Well, to put it simply, it's when the body loses so much fluid that the heart literally runs out of stuff to pump. There's just not enough volume left in the pipes. And if the heart can't pump, blood can't circulate, and the organs, they just start to shut down. This is, without a doubt, threat number one.
So how does this even happen? All of that massive tissue damage from the burn causes the blood vessels to become, well, leaky. Think of your entire vascular system turning into a leaky garden hose. The fluid that's supposed to stay inside the vessels just starts pouring out into the surrounding tissues. The body literally begins to swell up like a water balloon.
And here is the absolutely critical paradox. While the body is swelling up on the outside, the vascular system, all those internal pipes, is actually running dry on the inside. All the fluid is in the wrong place, and that is what leads directly to that deadly hypovolemic shock we were just talking about.
Okay, so you've got this invisible crisis going on inside the body. How on earth do medical teams know what's happening? Well, they can't see the fluid shifting, but they can see the alarms going off. The body sends out these very clear distress signals, and you can read them loud and clear in the patient's blood work.
The very first red flag is that the body's chemistry goes completely haywire. I mean, think about it. The burn destroys countless cells, right? When those cells burst, everything that was inside of them spills out into the bloodstream. This causes a huge surge of potassium, sending levels through the roof, while at the same time sodium levels just plummet.
And why is high potassium so terrifying? Because your heart cares a lot. Potassium's main job is to help regulate the heart's pump. So when you have way too much of it, it's like screaming at the heart to pump way too hard and erratically. And doctors can actually see this. On an ECG, it shows up as these very specific, tall, peaked T waves, a clear visual signal that the heart is in serious distress.
Now, as if that electrical chaos wasn't bad enough, there's another huge problem. With all that fluid pouring out of the blood vessels, what do you think happens to what's left behind? Yeah, it gets concentrated. The blood itself becomes dangerously thick.
For this particular patient, their hematocrit level is at 60%. Now, hematocrit is just the percentage of red blood cells in your total blood volume. And 60%, that is a terrifyingly high number. It means the blood is less like a liquid and more like sludge. Just imagine your heart, already struggling, trying to pump sludge through your body. It's nearly an impossible task. And to really put that number into perspective, just look at this. A normal hematocrit is somewhere down here, between 36 and 54%. Our patient is way up at 60%. That is far into the danger zone. This number is a direct measurement of the massive dehydration that's happening inside the bloodstream.
So the body's in shock, the blood is turning to molasses. How do you fight back? This is where the medical team starts a desperate race against the clock.
The answer is simple. It's direct, and it is absolutely the number one priority. You have to pour fluids back into that empty vascular system. That's it. That's the ballgame. And you have to do it fast.
And this timeline shows you exactly why that speed is so critical. The whole leaky vessel problem we talked about, it actually gets worse before it gets better. The most intense period of fluid loss peaks between 18 and 24 hours after the initial injury. You have to get ahead of that curve before the whole system just collapses. But you can't just pump in any old fluid. The solution of choice is IV lactated ringers, or LR. And why that one specifically? Because its chemical makeup is the closest thing we have to the body's own blood plasma. It's the perfect tool for the job. It replaces the volume without making those dangerous electrolyte imbalances even worse.
So, the IV bags are hung, the fluid is rushing in, the rescue mission is underway. But how does the team know if they're actually winning this race? They have to look for very clear signs that the body is finally starting to stabilize.
And there are two main goals they are laser focused on.
First, they need to get the systolic blood pressure back up to at least 90. Second, they need to see the kidneys start working again, producing at least 30 milliliters of urine every single hour.
So why are these two signs so important?
Well, a stable blood pressure tells you there's finally enough fluid back in the pipes for the heart to do its job properly. And that urine output, that is probably the single best indicator that the kidneys are getting enough blood flow to function. It's the first sign that you're pulling the patient back from the brink of total organ failure.
So if you take one thing away from this, it's that the first day is a frantic, all-out battle against internal fluid loss, not against the burn itself. It's a fight to refill